Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is dental care. We will be discussing this topic in order to raise awareness of what proper dental care is and why it's important. Joining us today is Dr. Abrar Kuchari, pediatric dentist at the Harford County Health Department, and Tina Dixon, dental assistant and office administrator for the Harford County Health Department. Welcome to our show, and thank you so much for being with us today.
Thank you for having me.
Thank you. So let's get right into it. If you both could just take a moment to introduce yourself and just let me know what your connection to dental care is.
I'm Dr. Abrar Kuchari, a pediatric dentist at the Edgewood Clinic. Public health awareness has always been an important topic throughout my professional practice, and especially after joining the Edgewood Clinic, where we raise awareness through preventative measures and addressing treatment needs.
That's awesome. Thank you. Ms. Dixon?
Yes, I'm Tina Dixon.
Hi.
Hi. I work for Harford County Health Department. I work at the two clinics, the two dental clinics that we have.
That's awesome.
One in Bel Air, one in Edgewood. I am a dental assistant and admin specialist, and where we love to put smiles on the little people's faces.
That's awesome. Thank you, ladies, so much. So let's get into our first important question about dental care, and that's what does dental care entail, and why is it an important topic to discuss today?
Okay. Your dental care pertains to your overall health. It's your teeth, your gums, your tongue. It's preventative care for oral cancer and disease. If you have good oral care, your overall well-being is impacted, and if you have good oral care, you'll feel better.
Yeah, that's great. That's interesting because, I think when we say dental care right away, we're like, oh, it's just the teeth, but it's so much more than that. Like you said, it's your teeth, your gums, your tongue. So it's really interesting to kind of to be here today to discuss the whole gamut of our entire mouth. Yeah. According to the CDC, children who have poor oral health often miss more school and receive lower grades than children who don't. This is very interesting. Why is this?
Well, untreated cavities lead to pain and infection, and that can affect children's eating, speaking, learning, and playing. And then in the year 2008 alone in the United States, over 34 million school hours were missed for unplanned emergency dental treatment visits.
That's a very interesting fact. I think sometimes that's often overlooked because we think, oh, if a kid's, it's sick, it's usually the runny nose, the stomach, but it could be even more than that, that kids actually miss school because of their dental care. So
it affects their overall quality of life.
Yeah, so I think that's really important because we kind of tend to miss that factor. So that's great that we're talking about that. What are some risk factors for getting cavities or just having poor oral health in general?
A lot of that is, it can be genetics. It can be eating poorly, sugary snacks and drinks, especially between meals. Appliances that they might have, either braces or any kind of retainers or anything that they have, traps food, which causes bacteria to form and which can cause cavities. Also, somebody with special needs that can't very well take care of their mouth like somebody that without.
Oh, okay. That's very interesting. What is fluoride and how does it protect your teeth against cavities?
Fluoride is a natural element that is usually found in water, and it affects your, it just changes the mineral structure in your tooth. So to start with, cavities happen when we eat sugary food or sugary snacks. Bacteria produces acid, and that weakens your tooth structure, then outer layer of your tooth, and with frequent exposure, that might lead to cavities. And fluoride changes that mineral content and makes your teeth stronger and more resistant to causing cavities.
Interesting. And so then what is community water fluoridation? Fluoridation. That's a tricky word.
So
Yes.
community water fluoridation is the process of changing the amount of fluoride in water, making it ideal or for cavity prevention. And research has proven that it reduces cavities risk or cavities prevalence by 25% in both adult and children.
That's really interesting. I think that's an important population health, factor that we don't think about as well as if we, help put fluoride in our water,
Yeah,
then we can do so much to protect just
It is
the
just
mouths
one of the
kids.
most. It is the most effective, cost-efficient
Wow.
way to deliver fluoride to everyone, regardless of their age, income, or education.
That's awesome. That's very important. Like I said, I think that's something that we don't really think about. It's important for us to, again, back to us being healthy, drinking that water, because we have some really awesome minerals. And again, if we have that fluoride in our water, it's important.
There, on that note, Rania, there are a lot of people that don't want to drink tap water.
Yes.
And so we usually, I've recommended to the patients to get one of the pure water filters, like one of the pitchers you can put in the refrigerator, because it still doesn't take the fluoride out of the water, but it would make them feel a little better about drinking tap water.
Yes, and then we're saving the environment too by not
exactly.
drinking
Using
bottled water. So it's great for everybody.
Yes.
What differences are there between adult oral health and children's oral health?
Okay, I think adult oral health is pretty straightforward. People are used to going to the dentist. You don't have to do a lot of fancy talking to them. You kind of just tell them what's going on and begin treatment. For a child, you have to make the experience fun, welcoming, calming. All they want to know is it's not going to hurt. So what I used to say as a dental assistant is there's no ouchies, no ouchies. We're just going to brush your teeth, and that's all they care about. That's all they want to know. So as far as children, we want to just make sure that their teeth, their baby teeth, are healthy and that they're growing in correctly, and then make the overall experience fun for them.
And then how about brushing their teeth? So is there any difference between adults brushing their teeth and children brushing their teeth? Do we still want to do the same amount of teeth brushing per day?
Yeah, we usually recommend 2 minutes twice a day.
2 minutes twice a day.
Yes.
And then type of toothpaste as well.
Yes.
Children up to age of 6 use kids' toothpaste. Older than 6 can use adult toothpaste.
Okay.
And I know a lot of parents are more hesitant about using kids' toothpaste because they're not comfortable of their kids swallowing that fluoride in the toothpaste. But if they just follow the recommended dosage, which is a grain size for kids younger than 3 and a pea-sized amount of toothpaste for kids older than 3, it's safe if they ingested that amount of fluoride twice a day.
Okay, that's very interesting. And the amount of toothpaste too as well. I think sometimes people get confused. They don't know if they're putting too much or too little on.
We have a little saying about that. You brush in the morning to keep your teeth. No. You brush at night to keep your teeth. You brush in the morning to keep your friends.
Oh, that's great. I love that. How should parents take care of their baby's oral health when they don't have teeth?
Well, they can start with wiping their gum with just a clean, soft, wet washcloth twice a day after their first feed in the morning, and then before bedtime, just to clean out that sugar in their mouth and bacteria to prevent cavities later on. And then they start brushing their teeth after their first teeth erupt with, again, soft toothbrush and kids' toothpaste, and then take them to the dentist by their first birthday.
That's great. I love that you mentioned about what to do for babies, because we think, because they don't have any teeth, there's nothing we can do. But it just goes back to when we talked about what does dental care entail. And we mentioned it's not just teeth, it's the gums too as well. So I think that's really important that we're discussing how to kind of help the babies before their teeth actually form. So it's great.
There's a lot of parents that think that baby teeth aren't important. They're just baby teeth. They're going to fall out anyway. But there's lots of things that can happen in between the time that
Yep.
the baby teeth come in
Yes.
and before I mean, because a
They
lot of,
stay there for a very long time,
Yes.
up to like
Yeah.
age 10 and 12, and they maintain the space, and then cavities cause all things we've talked about
Yeah.
quality of life.
That's great. According to the CDC, when you're pregnant, you may be more prone to gum disease and cavities. So why is that?
So all those hormonal changes that a woman goes through a pregnancy affect everything. It affects periodontal health. So 60 to 75% of pregnant women have gingivitis, which is a very early stage of periodontal disease. That's when your gum is swollen and you brush your teeth and your gum bleeds. And if that is not addressed early on or taken care of early on, along with all those hormones, it can progress really quickly and turn into a more severe periodontal disease. That's when your the bone that supports your tooth will just get less and resorb, and your teeth may become loose, and then your chances of having extractions are more.
Oh, wow.
And then also periodontal disease is associated with poor pregnancy outcome, like early labor, preterm weight, and it's all very connected.
Oh, wow. So it's not even that it just affects the mom, it affects the baby,
It affects the baby as well. Also, the second part is that is affected by hormones is pregnant women have more chances of having cavities just because of their eating habits changes. And then if those cavities are not treated during pregnancy, bacteria causing cavities are usually more if you have an active cavity that is not treated. And it can be actually transferred to the baby shortly after birth. And then those babies, when they have this high amount of bacteria along with baby bottle use, knife feeding, snackings, they can have early childhood carriers, more risk of having cavities. They're actually 3 times more risk of having cavities as a child if their parent have an untreated decay. And that requires an extensive dental care.
Oh, wow. So again, it's just important that if you have pregnant women, they should still go to their dentist.
That is correct. It is very safe.
Yes.
Very safe to go to the dentist.
Yes, and still practice all the important dental care that they do even when they're not pregnant. That's very interesting. How can someone with chronic diseases such as diabetes affect a person's oral health?
So when you have chronic diseases like diabetes, COPD, cancer, they're all very susceptible to periodontal disease, gum disease. And that's all the more reason that they should visit their dentist regularly so that they can stay on top of that so that it doesn't make their disease that they have worse.
That's really interesting. Okay, so hopefully I say this word correctly. What is edentulosum and what can cause it?
So edentulosum is tooth loss.
Okay.
Okay, tooth loss can be caused by many things: gum disease, including periodontal disease, untreated cavities, poor management of chronic diseases. They all cause tooth loss, and it's more prevalent in older adults, older than age of 75. But it's still very prevalent, especially in those who are economically disadvantaged or uninsured adults, adults with special care needs. Those are all more at high risk.
That's very interesting. So it's a new word for me that I've learned today. So edentulosum is basically tooth loss.
Tooth loss.
Okay. According to the CDC, about 3 in 4 Latinos and non-Latino Black adults have an unmet need for dental treatment, as do people with lower incomes. What other disparities do you see in dental care, and how can we work to change them?
Well, I think one of the things that we have now, as of January 2023, January 1st, 2023, Medicaid has expanded care to all adults. So if you qualify for full Medicaid, you can get dental care at no cost to you through there.
And that's really important
Yes,
for
very
those
important.
who are low income. And so that's breaking down that disparity there.
Yes.
That's really awesome.
Absolutely.
That's great. Is there anything else too that we can add about that? I mean, I think the one thing that we have here in Harford County that's so special is our amazing dental clinics that we see those individuals. So I think here in Harford County, we're already breaking down that disparity by providing that dental care in that Edgewood location. And then most importantly, our new location at 1 North Main Family Health Center. So I think that's amazing.
Yes.
And
yes.
they get to see both of your smiling faces too as well.
Yes.
That's great. And so now, what are some tips for maintaining good oral health?
Well, just by to start with, just maintaining a good oral hygiene practices at home, including brushing twice a day, flossing your teeth daily, watching snacks and sugary beverages. If you are a smoker, try to quit smoking. Limit alcohol consumption. See your dentist twice yearly, even if you're pregnant, it's still safe. Also, if you have a chronic disease, talk to your doctor about managing your disease, just so it won't affect your dental health or gum health as well. And if you are, and also, I guess that is mainly it.
Yeah. Yes.
Yep.
I agree.
Yep.
That's great. Okay, so definitely some really important takeaways, and we want to brush our teeth, go to your dentist, talk to your doctor, making sure too that when you go to the dentist, writing down those questions that you might have for them, especially if you do have a disease, to kind of see, you know, are you doing the right thing? Are you on track to keeping your oral health good? So those are some awesome tips to have for everybody to hear. What are some resources for dental care that are available in Harford County?
So basically what you just discussed before was our 2 dental clinics that we have, the one in Edgewood, which has both the general dentist and the pediatric dentist, Dr. Kachari. And then the one in One North Main, Dr. Rojas. She's a pediatric dentist. There are also a number of other providers in Harford County that do take Medicaid. So that is pretty much all there is to offer. But there's quite a bit.
Yes, there is. And we have some awesome people that work at our dental clinic, and so many other things we can connect you to resources to as well. So you can go get dental care, but then we have so many other resources at the health department as well. So you're not just coming in for dental care. We can also be there to help you with some care coordination, connect you with some other resources that there are in the community. So really that one-stop shop for all of your needs, which is great.
Yes.
Is there anything else that you both would like to add for today?
Well, I would like to emphasize again on the importance of maintaining good oral hygiene. Just start at home, and then seeing your dentist twice yearly or every 6 months, so we can address problems early on. And then take your kid to see their dentist, especially after their first birthday, just so they would be more comfortable seeing the dentist, more comfortable getting into the dental chair. So by the time, if they get cavities at any point, they're comfortable getting treatment. We know it is hard sometimes to go to the dentist. We know it's hard seeing your child cry in the dental chair, but we're here to help. We just want your kid to be comfortable.
And like Dr. Kachari said, if you start them early like that, it's a fun place for them to come to. And they do enjoy it.
Yeah, I'm very lucky. I was one of those people where I've started seeing someone early, and I always joke about it all the time. I love going to the dentist. I like getting my teeth cleaned because it just is such an important part of, like we said, our overall health. So I'm always like, can't wait for my dental appointment, and I can't wait to see my dentist.
I didn't like going to the dentist as a child, so I can completely relate to how those kids feel like. I don't remember like going to the dentist, but I went to because I had no choice. I eventually just grew me, I guess. So I know how they feel. But it just but it's you get more comfortable as you go.
It's the best thing that parents can do for their kids, and it's one of the things that adults can. It's important for adults to continue throughout their life, just to really kind of protect your overall health. So that's great.
One of the things we do offer too in Harford County is we do a screening and a sealant program in the schools.
Oh, wow.
So there are a number of local schools that we have a hygienist go out to, and she is involved and does screenings and apply sealants there at school.
And that's really important.
Yeah, but the sealants are the, like we call them polish for the teeth. They're like just a white or the clear layer we apply on the chewing surface of the back teeth to protect the chewing surfaces from having cavities, and they protect teeth for a few years.
Oh, wow, that's really awesome.
And
That's
then
great.
she can also send, if she sees an urgent need, she lets mom, dad know. She sends home a paper that please take them to the dentist because they really need to have something looked at.
That's really great. That's
So, yeah,
awesome that we
it
do
is
that
great.
in the
Yes.
schools, especially, parents are so busy too nowadays, so
Yeah.
it's hard to kind of do taking the time off, taking the kids to the dentist. Sometimes that could be a barrier, so that's another barrier that we're breaking down at the health department to really make sure that the
Yeah.
oral health of children.
Yep.
Yeah, and we know it's working when we
Yes, it
actually
is.
see some
Yeah.
of those patients
Yes, we
actually
do.
walk in
That's
just
great.
because they were diagnosed, like they were told at school by the hygienist that they need to be seen.
That's great.
Yeah.
Thank you, ladies, so much.
You're welcome.
Well, that's all the time we have for today. I'd like to thank my guests on today's show, Dr. Kuchari and Ms. Dixon. If you would like more information on dental care, please refer to the resources page after the show. And join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you by Harford TV. Watch what matters.